Welcome, everybody, to our quarterly Health Workforce Council meeting. We're taking a moment just to admit everyone into the room. And if you go to the next slide, please, you can see we have a prompt as people are joining. Please use the chat feature and share your name, your title, your organization. And if there are any specific interest or projects in health workforce development you're participating in or you would like to participate in, or if you're already working with us in one of our work groups, feel free to mention that as well. And we'll just take a moment here and wait and see if we have anyone else joining us. We'll drop this prompt in the chat box for you as well. And we can move on to the next slide. So we have a full agenda today. I'm excited to share we're having the Centers of Excellence. John Carice is going to present on labor market research specific to our Santa Cruz, Monterey County, and the 6 workforce tracks that we identified in our listening tour that we conducted at the beginning of this year. We also have John Cordova from Futuro Health, and he's going to share exciting updates about a new program they're launching, which is a surgical technician program, and it's a virtual program. So I'm really curious to hear more about this. I'll share at the very end a brief update on the Health Workforce Council, some of our quarterly milestones and what our work groups have been up to, and then we'll close out. So we're here together for an hour and a half. And thank you all for being here. So with that, I'm actually going to hand it over to John Carice to jump into presentation.
Thank you, Haley. Good morning, everyone. I'm John Carice. I'm the director for the Bay Region Center of Excellence for Labor Market Research. I'm hosted, our community college where I'm hosted by our grant is City College of San Francisco. The center does labor market and workforce research for all 28 colleges in the 12-county Bay region. And we also work with our K-12 districts in the region, workforce organizations like Haley's group, Health Improvement Partnership, workforce development boards, and economic development organizations. So we're trying to not only serve our colleges, but all their partners that they work with to try and provide a skilled and trained workforce to Bay Region employers. So you can see on that slide, if you get the slides, just go back just for 1 second, you can get the website, coeccc.net, where we've got lots of great labor market data and reports, not just for our regional center here in the Bay Area, but we have a network of 8 regional labor market centers across the state, funded by our state chancellor's office. You can see data for the whole state based on the regional center and what they're producing. So next slide. So just a little bit of, well, before I even talk about data sources, I want to thank Haley for inviting me to present. We've worked a little bit together on the report that she's producing right now, and I'm kind of providing some technical assistance to her about understanding the demand data and the supply data that we have in our data sources that we use to try and understand what's going on in the labor market. So here are some of the sources, just to kind of let you know what you're going to be looking at and where the numbers are coming from. So EMSI Burning Glass is occupational data, hourly earnings and projected demand for occupations. And it's coming from economic modeling, EMS Specialists Incorporated, but they're now renamed Lightcast. So they're just making this transition. When we were pulling this data, they were still being called the EMSI Burning Glass, and now they're actually being called Lightcast. But that's just kind of an inside baseball note. But The second source to the right of that is Insight Center. That's where we get data for living wage in our region and by county to understand what a living wage is for a single adult in the county. And then you can also look at data for adults with children, but it gives you a sense of like, okay, what is that wage? What does the wage for the occupation look like? A median wage, for example, compared to what the living wage is and the cost of living is in the county. Then below, there's two data sources that we're using and looking at. Community college program awards, that's from Datamart, that comes from our community college chancellor's office. That's giving us the certificate and degree awards from the community colleges, in this case, in the Santa Cruz Monterey region, and based on program of study codes. We call them top codes. So we'll be looking at 6 different healthcare programs of study and the awards that they provide in the subregion. And then other post-secondary program awards, we want to make sure we're looking at the whole training, education and training landscape, not just community college training programs. So the other post-secondary program awards that are factored into the supply analysis are coming from something called IPEDS, and that's Integrated Post-Secondary Education Data System. That's federal data. So all training programs have to report their data to the federal government if they're getting any kind of financial awards, if they're providing federal funding to students to attend programs, they have to report, it's mandated. And so that data gets collected and we can look at it and see how many non-community college training programs are granting awards for specific programs of study. So that's kind of a quick overview of the data the source of the data that you'll be looking at, sources of data. Next slide. So as Haley mentioned, this is this kind of report you're working on, and what I'm going to highlight here are what are the 6 workforce tracks that you're focused on in this work. And the first one is behavioral health and health social workers. So what you're looking at is a summary, and then we'll show you a couple slides, at least one slide that's got some more detail about the data you're looking at. But at a very high level, what we tend to do with labor market research is we want to look at the annual job openings for an occupation or a cluster of related occupations. And then we want to compare that annual demand to annual supply. And we're always using annual to annual on demand and supply. So we're comparing apples to apples. We're also going to be looking at that data in the exact same region. In this case, it's the Santa Cruz Monterey County regions. And that is because, we want to make sure the data is comparable. We're looking for the same geography and the same time frame. So annual data from the same region. So annual job openings for 3 related occupations in this track, behavioral health and health social workers, are substance abuse, behavioral disorder, and mental health counselors. The second one is mental health and substance abuse social workers, and the third is clinical counseling and school psychologists. So when you look at the annual awards from those 3 occupations, you total them up, you get 170 annual awards for all 3 combined. And that's an average over the 2020 to 2025 period, which we were looking at. And it's all just for Santa Cruz, Monterey. So that's on the demand side. How many openings are there annually for those 3 jobs combined? 170. Then we want to look at the supply of students that are trained to take those jobs in the labor market. And that supply is 63. So these are graduates of master level educational training programs that prepare for these occupations because they do require that advanced degree. And the awards from all training programs in the region on average over the last 3 years is 63. And so you just do the math at that point. The gap then, or the undersupply, is 107. That's just the difference between the demand of 170 and the supply of 63. So annually, it looks like on the surface from the data sources we're using that there's an undersupply of about 100, a little over 100 master's level graduates for the openings are available for those 3 jobs in the subregion. So next slide. So the training programs that we looked at for the supply were from CSU Monterey Bay. They have on average 45 awards a year for their MA social work program, 9 awards from CSU Monterey Bay for their MA school psychology program, and another 9 awards from UC Santa Cruz's MA psychology program. So that that's giving us the 63 awards that you saw on the prior slide. Okay, next slide. Okay, registered nurses, always a really important, and actually it's registered nurses, and we'll break out registered nurses and licensed vocational nurses. We'll combine them first, and then I have some data to kind of tease out the differences between those 2 occupations. But very important, there's usually a lot of demand across our region for registered nurses. And so let's look at what the numbers tell us. Current average annual job openings for licensed vocational nurses, LVNs, and registered nurses combined is 385 in the subregion. Annual supply of graduates coming out of LVN and RN programs, again, we're combining the supply of those 2 types of programs from community colleges and other educational training programs is 263. And so you have an undersupply of about 122 in the subregion in any given year when you're looking at the difference. Now, what I'd like to do is kind of break out, go to the next slide, please, and I'll break out those 2 separately. You're looking now at the supply for registered nurses only. And so that supply, I have a little note for myself, is 210 when you add it all up. And then you look at the demand just for, we don't have a separate slide on this, but the demand just for registered nurses out of that total that we were looking at is 295. So RN demand is 295, RN supply is 210 coming from these institutions that you see there. And the difference between those 2 then is 85 in any given year. So that's kind of breaking out RN separately. And then if you go to the next slide, this is supply for LVN programs in the subregion. There's only 1 college that we could find data for, and that's Hartnell College. They're providing 53 awards on average annually for some are AA and some are certificates for LVNs. When you look at the demand for LVNs annually in the subregion, it's 90, and this supply of 53 annually, then if you compare the 2, you've got an undersupply of about 37. So you've got undersupply for both LVNs and RNs, and then also when you combine them, as you saw in the very first slide, you've got kind of a total undersupply of about 122 when you're combining the 2 occupations demand and the supply from the 2 types of programs that train for LVNs and RNs. Okay, so let's go to the next slide. Okay, medical assistants. I'll share a little secret with you. Haley and I were going back and forth a lot on this, even up through this morning, trying to get these numbers right from the training programs. The thing that was challenging was the data from Central Coast College. They kind of had a missing piece of data from their, I think it was 2019, 2020. And we wanted to try and track that down. And Haley did some great investigative work and research to get them to respond. And so anyway, we do have a number for them now. So medical assistants, and was talking to John and Haley about this before we came on the webinar. Medical assistants can be a little tricky in the sense that you've got kind of this distinction in medical assisting jobs and in the programs that train for them. There are clinical medical assistants, and there are also then more administrative administrative or front office, sometimes they're called, and medical assistants. And so that sometimes it's hard to tease out what is the training program data that you're looking at here. Which are they training for? Are they training for both? Are they training for one or for the other? So that's where you have to kind of go down to a more granular level. I think in particular, looking at this program and really understanding what these programs are training for, or they, as I said, for one or the other or for both. But at a higher level, we'll look at just the broad numbers here. The annual job openings for medical assistants in the subregion is on average 231 a year. The supply looks like it's about 267 when you add up. There's training programs here from we didn't have enough room to fit them all. And on the next slide, I'll show you there's a few more, but when you total them all up, it's about 267. So that looks like we're in an oversupply situation, meaning we have more supply for medical assistants in the subregion on average annually than we do have demand. But again, I think that this is maybe something that your group can look at more closely. Is that really true? And this is an exercise of validating both the demand number and the supply number, particularly related to the issues I was raising, to make sure you really understand what's happening around medical assistant training programs and the number of jobs that are really out there. And should you, at least I would say it's a good time to pause, kind of be cautious, and make sure you're not starting any new training programs in the region, or that you're really just making sure you understand exactly what your programs are doing and who they're graduating and which type of MA job they're going to. Can you go to the next slide, and I'll just show you the additional training program data we found for MAs. I think CET stands for Center for Employment and Training. Haley, is that right? Do you know? Pretty sure, yeah. And so they have 3 different sites in Salinas, Soledad, and Watsonville. You can see the average awards from each of those kind of more localized CET programs. And that was all added and factored into the prior number of 267 awards on average annually. So there's a lot of training going on for MAs in the region. It's really good, I think, as I said, to understand more about that before you proceed, certainly with creating any more new training programs. So that's the story on MAs from the data point of view. Can we go to the next slide? Okay, the next workforce track is community health workers. This is a really important area for healthcare and public health. And they're a job that not emerging anymore, but back a few years ago when I started doing this work, it's definitely more of an emerging job, kind of the work of doing community health in a community, in a community or a subregion, and all of the needs that patients have, maybe more than beyond what they would just be able to receive at a hospital. So community health workers in the subregion, on average annually, we have about 22 job openings for community health workers. There's only one training program at Cabrillo College, and they're on average producing 3, graduates a year with their certificate to go out into the labor market. So we've got a gap of about 19 or 20 community health workers in your subregion. So very kind of low demand in a way for the subregion, but even lower supply. So that might be another program to look at, and maybe even see if Cabrillo could increase the number of students they're serving and sections they're offering to try and close that gap a little bit. But it's not a huge gap. So again, that's another area. This is another area to be a little cautious in and figure out really what's happening on the ground. And do we have accurate numbers for openings from employers and supply from all the colleges? There might be another college out there that's training beyond Cabrillo, but we didn't see it in the data. Okay, next slide. Next track is physicians. Of course, this is advanced training, education degree that's required for this. Annually, job openings of about 37 in Santa Cruz, Monterey, and no supply that we can find in the data mart or the IPEDS data for physicians being trained in this subregion. There's probably physician training going on in other educational institutions in the Bay Area, but not in the Santa Cruz, Monterey subregion. So there is no supply. So the gap really is what we have for demand, which is 37. So that's for physicians and family medicine physicians that we looked at. Okay, next slide. Next track is surgical technologists. Again, another one where we've got relatively small annual job openings of 18 for the subregion, but no supply, no programs that we could find that were training for surgical technologists. And so the gap is 18 because there's, it's 18 minus 0. So that's what it looks like for surgical technologists. And that might be the last track, or do we have one more? Nope, that's it. Okay. So I do want to emphasize that, and I said this to Haley and John when we were coming on, the data is a really good place to start. I think it's pretty good data. It's really helpful to kind of look at this analysis of demand versus supply and look at it for just your subregion. But it shouldn't be, you shouldn't kind of just go from here and say, okay, that's all we need to know. It's a starting point really for further investigation, further information gathering, and further connection with regional employers to make sure that you really understand the story completely and that you're validating these numbers and making sure you don't have anything really wrong. So it's a good starting point for discussion and dialogue with employers and educational institutions. But I always encourage people to do more work beyond this and understand more about what's happening in the labor market by just talking to employers, talking to educational institutions to validate the data. Okay, that's it for me.
Thank you, John, so much. We have some time for questions, and I see Adrienne has her hand raised if you want to go ahead and unmute.
Hi, yes. One question I have is in the data about who is being employed. Is there a way to find out about the demographics of that population? One of the goals that CHWs are trying to fulfill is that they are reflect the community that they are serving. And I just haven't had, I'm not sure where to go for that data. Mm-hmm. Thank you.
Well, it's easier for us to find demographic data, Adrienne, on the training program side, on the supply side. We do have a tool called Launchboard that the Community College Chancellor's Office has created and continues to update with data. It shows us the demographic breakout by race, gender, race and ethnicity, gender, and age for the students that are coming out of our program. So this kind of who's getting our awards broken out by these demographic metrics. As far as the occupations, you can't really get, in other words, there's demand for a certain number of medical assistants, right? We don't know who the employers are going to hire into those openings. So it's really kind of, once they hire them, you could maybe go to the employer and try and understand more about what's the demographic breakdown of who they actually hired. But we could tell you on our side, what I mean by that, by the college or education and training side, what's the demographic breakout of the students that graduate and go into the labor market. Does that help?
Yes, thank you so much.
All right.
Any other questions for John on the data we just heard about today? If you have a question, feel free to unmute and ask it now. You could also drop it in the chat and we'll try to address those if we can. I'm not seeing any hands raised, so I think we can move on. So next slide, please. I think this is a great segue, as we just mentioned the gap we have in providing surgical technician training in our region, to introduce Futuro Health's new surgical technician program. And so unfortunately, Joy is sick today and won't be able to join us, but we have John Cordova here with us today, the Director of Workforce Development and Clinical Partnerships at Futuro Health. And if you're thinking Futuro Health sounds kind of familiar to me, it's because Von Tonquevillen, the CEO of Futuro Health, was our keynote speaker at the community forum that we hosted this September. And so we're excited to bring back representatives from Futuro Health to share with us about this new program that they're launching. So with that, I'll hand it over to John.
Thank you, Haley, and apologize for my voice because I woke up feeling ill today. So I'll try to get through this without coughing. Joy is actually out sick as well. So you're familiar with Von Tonquevillen, who was the Vice Chancellor of the California Community Colleges for some period of time. I'm also from the California Community College system of 20 years. I retired early and was able to join Von here at Futuro Health to look at how do we solve some solutions that we couldn't solve within the system that we were working before. And so Futuro Health is actually been founded through a network of large entities that provided us the vehicle to be who we are. So next slide. So as we know, we talked about the workforce, and John did a great job about looking at, what are the needs, what are those gaps at in the current workforce that you're looking at. I look at it from a whole statewide perspective, as I did before, and I do that now. So when we look at where these challenges are, and it's grown even post-pandemic of where these workforce shortages are, not necessarily because people are not interested, but often because of salaries and do they go into these roles that is a little bit more demanding in workload with taking care of patients for salaries or wages that I can get where I can actually go work and flip a burger. So we need to kind of look at how do we refocus people into going into this workforce that are caring and wanting to grow, because what we focus on at Futuro Health is a gateway training, or that entry level focus to get people's foot into the door. Next slide. So our mission is really to do that, is to grow that largest workforce. And so part of that is really to look at where are those gaps throughout the state? Where do we need to help focus on? And we get funding through a collaboration of partnership between UHW, the union, and Kaiser Permanente. And now we actually have other partners such as Dignity and Sutter and Common Spirit that are providing funding to us that actually helps eliminate barriers for people to get into allied healthcare. Next slide. So part of us is to really look at who are we serving. Our demographic is the demographic most often employers are looking for. We're looking at those who are coming from diverse and different cultural backgrounds. Our average age, and we'll see some statistics, is 30. We have bilingual, predominantly females that are actually inside who go into healthcare, but we're really trying to figure out how to drive more males into the healthcare, allied healthcare arena. So how do we do that? We do that by creating a path, or we create, part of when I first started, we didn't have direct pathways. We had programs. And so we're now building those pathways, which will lead to what we're talking about, the surgical tech program. Next slide. So here's a little bit of our demographics. We have an 80% diverse population, 51% bilingual, 30%, 30 is our average age of the individuals who we serve. Next slide. And so part of our journey is that we look at how do we support students, and this should come back a little later, but one of the things we do is we have what we call our success coaches. But any student that actually comes through our scholarship, so we are a scholarship-driven organization. So we're a nonprofit, scholarship-driven organization. What we do not do is we do not write scholarships to an individual. What we do is we work with educational providers and look at how do we scale and the seats available for students to get into these programs. And so that's why we're able to bring innovative approaches such as the Surgical Tech program we'll talk about in just a little minute. But each of our students actually take what we call our onboarding, our prerequisite course, which is a 8-week training program in these areas, these 6 soft skill areas. And so they have to complete this as part of their prerequisite to get the full scholarship to get into our programs. Looking at cultural competence, health and compassion, empathy and ethics and teamwork and all this. And students have actually said that this has been more powerful for them coming out of and getting into a program because they're learning more about themselves that they didn't know before they had in the past. So it's really able to now go into a program and actually use these skills that they're learned up front. Next slide. So this is when we talk about student success coaches. Most unlike other programs and scholarship programs where people just write a check, we actually have an assigned success coach for every scholar that comes through the door, so that when they're starting to the application process, through the approval process, these success coaches are assigned to them and they're walking them through that. They're with them throughout that whole human touch healthcare 8-week training program. They're with them when they actually go to a training program, start the training program. They're with them throughout the training program. They're with them throughout the end of the training program. And then we're there until we get into employment. So their success is our success. So we have that built in as a mechanism to support every single scholar that comes through our door. Next one. And I'll just go through these real fast. We have 2 different coaches. We have the success coaches that really supports the students through their whole journey. And then the next slide is the student outreach liaison, where you can go to the next slide. The next slide is the outreach liaison, who's actually somebody who's really focused on the students. You can go to the next slide. There you go. So focus on the outreach of the prospective students that are coming in. So we have somebody who's there to walk with the student throughout the thing. We also have somebody who's out there to continuously outreach to new students. And we have a what we call our own recruitment engine. People are coming in and recruited from the outside into our training programs. So when we look at our scholar journey, the next slide, please. A scholar journey is really looking at what are we doing through each one. So the next slide just talks about steps 1 and 2, and just really kind of going back to what we just talked about. They find out who their coach is, and once that coach is there, we have this either a one-to-one conversation about who they are and what they're looking for to make sure, is this a good fit for the person, and also are they a good fit for the program that they're getting into, because we're making this investment getting into a program. So they also do that. Once they do that, they select a start date for the human touch healthcare so they can start that prerequisite journey. Then after that, they get into the 8-week training program. And during that training program, the coach is actually reaching out to them and talking to them and seeing what's going on, and then starting to look about what provider they're going to be connected with and what program. So we have a collection of over 19 education providers with 65 campuses throughout the state. We have a lot of programs that are online and asynchronous, and as well as hybrid programs that we offer to the students. Next slide. And then while they're inside there, they enroll them in the technical program, they prepare them, make sure that they have everything that they need for requirements, vaccinations, physical, all that kind of stuff prior. And then as they're enrolling into the program, there's also a checkpoint in between. So we have these milestones that each one of them reach out. The student is always able to reach out to the coach for anything that they need. So we even have built in for crisis support. So if something's happening to the student and their educational provider isn't able to support them, how do we support them? And we provide them with that opportunity to come back to the coach and say, I need. So next slide. And then once they complete the program, our program completion is really looking at the didactic and the clinical proportion. That's what we call completion. And then we will be working with another entity that's providing career services for people to get them employed And then the eligible jobs goal is to get every single person employed from the end of our programs. So really looking at today is the surgical tech program that we want to talk about, and that's the next slide. We have a unique surgical tech program that we have partnered with education providers. So we are not the educational provider ourselves. We do not do any of that. What we do is we provide the scalability and work with education providers throughout the state. Some of our providers are out of state, but they all meet California requirements and regulations. And so part of my role is to really look at where are these jobs. And I think John did a good job of setting up to talk about surgical tech program. The surgical tech program that we have in place, working with this provider, is to help get people into what we call a level up. So we're taking people who are surgical sterile processing techs. And part of that is we have in our program roadmap sterile processing tech as one of the offerings for students. They're able to take that, and we provide that full scholarship for surgical tech, for sterile processing. Sorry. Once they complete that sterile processing tech, if they want to move up to the next level, which is surgical technician, that's where we actually have the level up, and we are offering a pay it forward loan for this particular opportunity for the students to get into here. What's different about this program is the program curriculum is all online. We do have labs, and I'll talk a little bit about where our needs are for partnerships, and that's kind of why we're here today. I think, Haley, is to talk about how do we help service your area for some of those needs that you have. So next slide. The surgical tech program, again, sterile processing. So there's two ways that actually students can come in to the program, and one is through that sterile processing program that we have, and they complete that sterile processing program, and then those courses and hours align to the associate's degree for surgical technician, and so they get credit for that if they are already in that particular program. If a student or a potential scholar is already working out there as a certified sterile processing technician, then they take that certification and apply that towards the associate's degree, and they have to take a few other courses to meet the requirements for them to go into the surgical tech program. Next slide. So this program is very lengthy in that where we are needing is partnerships for the clinical and labs, because there is requirements for the clinicals and labs in the surgical tech program for the associate's degree level. So I highlighted on this particular slide what those look like, the lab and the clinicals times and set of hours that are needed for each particular thing. So if you look at labs is 360 hours. And then the clinical is actually the practicum hours that they're actually doing hands-on patient care. The labs is really having access to a location so that they can actually get their hands on instruments and look at the different things that they're going to be doing when they get to the clinical portion. So what we are looking at is we are actually providing the training, but we're looking for the externships or clinical labs sites to help do that. Part of that partnership could be these are potential students that you're going to hire to fill those employment gaps in your area. Next slide. So as you see in the slide, you can see that the sterile processing tech diploma is there, and there's a shorter training program, 10 months, but then when you go into the surgical tech program, that's extended. So depending on how you go in there, it's 16 months, but if you're coming in there from a different certification already, you already have that certification, there's a couple other courses that you have to take prior to coming into the actual surgical tech program. So there's two pathways to get in. Next slide. And this kind of talks about the technology program as a whole, that you look at the entry-level sterile processing, we get them into the surgical tech program post-completion, and then the surgical tech program will be focused on how do we get them into the job. So what happens is that what we like to do is partner with people who can hire the sterile processing techs, and then so the students can actually then apply for a PIF loan or the pay it forward loan while they're working, or if there's shared costs for tuition reimbursement, that the student can actually request money from the employer towards that, so it brings down the cost to the student. At the end of the day, our pay it forward loan, there's two ways that the loan gets repaid, and part of that is either the employer can pay off the loan and just hire the student, or the student is able to, the student is able to either work off that loan by staying with the employer for a set amount of period of time that they come back and tell us each year that they're still working at this. If they're unable to find a job under a certain salary range within the year to 2 years after completing the program, then the loan gets wiped off. So again, the goal isn't to really to set the student to have to pay back a huge loan, because the loan that they do pay back is to pay it forward so that we can actually offer opportunities to other students. But if the student is not able to find a job, or are able to find a job that's securing that salary range, that threshold, then the loan gets written off. So it's really looking at how we better serve the student. But the program is developed so that we have that hybrid learning. There are instructions that are actually reaching out to the students throughout the whole entire program to help develop some of those other skills, and then we have the labs that are available to students. Next slide. So this is kind of a generic viewpoint of what the semesters look like over the 4 period of time. And so where we're looking at is like on semester 2, there are skills labs. The semester 3, the clinical practicums and clinical practicums, and then semester 4, the clinical practicums is where we actually need partnerships. So, and this doesn't mean to have to be 10 students. It can be 1 student, 2 students, depending on location. Next slide. The next 3 slides are just really kind of outlining what it is for the skills labs, what they need for that hands-on experience, what is required. And part of that is that we will have an instructor there. There's no need for the employer to say, oh, well, I need to release staff time to be an instructor of the day. Now you can do that. They would hire that person to be an instructor for them, but they will have an instructor there. It's just a matter of having that clinical affiliation to be able to use that lab space for the students to hands-on. And the same thing with the practicums. The practicums will be that the student is assigned to one of your employees to follow them throughout that surgical, that clinical practicum time. So if you go to the program eligibility requirements slide, so it's really looking at how do we get them in. These are some of the requirements for the generic program. They have to have a diploma in sterile processing or a certification. And so if they have a high school diploma or GED coming into that, there is an entrance Wonderlic assessment that they take. They're able to take it several times to get their score up. If they're like me, when you take an assessment, you always kind of don't do so good at the very first one. So they can actually take it a couple of times. And then they get into the sterile processing program, surgical tech program. There is background checks and there is drug screens that are required per the clinical sites, such as that most of you know about. Next slide. Excuse me. So most of you might see that, and when you look about labor market information, you're looking at a lot of times you're not going to see sterile processing as what the goal is. It's usually medical equipment preparers is what it's under. So when you look at some of that, that's why you see different titles of what they are. But the credential for this is the Certified Registered Central Service Technician upon enrollment for that particular program, because they already have all those pieces of it, and then they apply it into the sterile surgical tech program. Next slide is just basic LMI data. John's kind of already did that. And then the California labor market is the next set of information for what is needed and where those jobs are usually at. So when we work with this provider, we're very excited because we have a huge interest into the sterile processing tech. And when we did a survey with all the students in that sterile processing tech for them wanting to go into the surgical tech program, there's a huge interest of wanting to do that and continue on to that level up program. So we're really trying to figure out how to spread the wealth with students across the state based on partnerships that we're looking at. So that's part of my role, is to really look at those that are interested in and need to set surgical techs into their employment, hiring them in as a sterile processing tech, and then we can get them into the education piece for sterile surgical technicians. Let's see a question. How's your program doing on the amount of instructors to students? Are you able to fulfill the need of instructors in order to enroll 100% of the selected student applicants? So the provider, yes. So we have the didactic portion of that, and so we're not the educational institution. We have contracted them to provide this education for us, and so they have their faculty. When it comes to the labs and the clinical sites, there is requirements per student threshold. So they can, like I said, hire one of your employees to be one of the instructors of record for that day, or they will source an instructor for said location. And then the last slide is just our contact information for Joy or myself. We do have other programs. Surgical Tech is one of those programs that we have on the roadmap for 2023. But we do have a lot of other programs. You can go to our website at futurohealth.org and see the programs that we have available to scholars.
Oops. Thank you, John. We have some time for questions, and I see, April, you have your hand raised.
Yeah, I was the one that asked the question about instructors. It came up in our meeting yesterday in the nurses work group that we're struggling to, have enough instructors in order to be able to fulfill the need of the nurses in the market. And that's why I asked that question. I guess I didn't gather that your program doesn't supply the instructors. Is that what I'm understanding?
So Futuro Health doesn't supply the instructors. The ed provider does provide the instructors.
The end provider?
The educational provider.
Okay.
We're contracting seats with that education provider. They're doing what we're asking them to do for us.
Have you noticed they're having any issues with getting instructors for the programs?
Not
so your struggle is more the clinical sites.
Our struggle is the clinical sites, yes. Because we're offering these innovative programs to where the instruction is online, and then they have to do these labs and they have to do the clinical hours. So that's where, because we have people in the sterile processing tech program across the state. And so for next year, for 2023, we have, I think, allocated 250 scholarships for sterile processing techs. And then out of that pool of students, we have, I think it's 75 seats allocated for sterile surgical tech program. So depending on locations and partnership locations, because I can't say, okay, April, you're in the program if there's no clinical partnership that we have in the area that you live. So it'll be difficult to approve students in that sense.
Wouldn't that be one and the same, the clinical partnership and the instructor at the site? I mean, isn't that kind of a interchangeable need?
It could be, depending on location. So like we said, with our provider, they have instructors. So they have actually flown instructors out to meet the instructor need. But again, there's an opportunity to hire one of your employees to be the instructor of record during that period of time, granted both entities agree.
Okay, thank you.
Yeah, some sites have actually said, yeah, you can use our site, but you have to use one of my staff. So because we're using their site for the clinical labs and they're more familiar with their space, so they'd rather them hire them because they know that. So that's perfectly fine.
John, I have a question. Let's say I'm an employer and I'm interested in becoming a clinical site. What does that process look like on the employer end?
Just you would have to contact me, and then we will look at location. So what we'll do is we'll end up I'll look at location where you're at, what students we might have in that location to be able to do that, to fill their need, because I might not have students in that particular area. So if I don't have students in that area, it would be hard to say I'm going to put somebody there. But then there's also the opportunity for said employer to say, hey, I have 3 sterile processing techs that I want to do this. Then I can talk to them. It's like, okay, how do we upskill level up those students to X, Y, and Z? And so we can actually have that discussion.
Okay, that was actually my next question. Yeah, like if we already have staff that we want to upskill into the program, they could. So just reach out to you basically and explain what you're wanting to do. My follow-up question, I don't know if you're at liberty to share, but is the educational provider you contract with a single contract, or are you contracting with multiple different educational providers? And I heard you mention like they'll even fly an instructor out. So are they even like physically located near us in the Santa Cruz, Monterey counties?
No, this one's not. This is an out-of-state education provider, and they meet all the requirements and standards for California. That's one of the things that I vet to make sure that we're not just going by any particular willy-nilly provider. And depending on the program, so like medical assistant, we source, I think we have like 8-9 different providers throughout the state for that. This particular program we're concentrating on the one provider at this point.
So just to reiterate, the entire educational piece is online through that educational provider. And then the clinical placements are done, obviously, in person. So, okay.
Yes, didactic is online, clinical labs and clinical practicum requirements.
Great, thank you. Any other questions for John about the program he just went over? Well, actually, my final question is, when is the surgical tech program launching? I know you mentioned this coming year, but is there actually a timeline for that?
So yeah, we are going to be launching this program. So because we had some hiccups the way that we needed our needs met. We're going to be launching this towards I think it's September, with the students enrolling in, and there are like I don't want to say they're prerequisite courses, but they're courses that are part of the associate's degree program, but are not program specific. So we'll start them in September in those pre-courses, and then come January, they will actually enroll in the sterile surgical tech core curriculum courses. So that's when we'll really need the clinical partnerships in the labs.
Okay. And I see a question came through the chat for you as well.
So we are having a problem with our MA program, very difficult to find instructors to properly fulfill our program needs. Synchronous or asynchronous online instruction. So the surgical tech is asynchronous instruction, but they have scheduled discussion groups with instructors for the students throughout the program. So
Great, thank you. Any other questions for John? before we move on. And you can also drop questions in the chat as you think of things. Okay, I don't see any hands being raised, so we will move on to the next slide. Thank you, John, for
Thank you.
thank you both Johns for your time and presenting today. I'm gonna just share a few updates about the Health Workforce Council, and it looks like we'll probably get to wrap up a little early today, which is nice to give people back some extra time on their calendars. So some of the quarterly milestones of things we've been working on since our last quarterly meeting, which was in September, I believe. We did a listening tour with HIP's pediatric work group. This is a work group that's already established and has been meeting weekly around pediatric health. And we wanted to listen in and also listen to the challenges and barriers and issues that they're facing in pediatric workforce. So we'll be launching a monthly workforce meeting within that group that's already meeting on a weekly basis to address pediatric workforce, specifically the need for, as we saw in the data earlier today, for physicians and family medicine doctors. So we'll be launching that soon. So excited to share that update. And then as you can all glean from what we just learned today about John, from John's presentation, John Cordova's presentation, looking into maybe how could we bring a surgical tech pathway to our region, either partnering with Futuro Health, or there may be other avenues to explore. And the idea would be to launch something in the new year, working and consulting with employers, local employers, on their evolving needs in surgical tech. And how could we partner and maybe create a work group around that, or help establish a pathway for our region. And then, as we saw today, again, thanks to John Carice, we've completed our gap analysis of health career supply and demand for Santa Cruz County and Monterey counties. And all of this data will be incorporated into HIP's Health Workforce Council 2023 Workforce Report and Recommendations, which we're hoping to have completed by June of this coming year, 2023. You can go to the next slide, please. A few updates about what our work groups have been up to. I'm excited to share, so through conversations and collaboration with our behavioral health and health social work group, we are working with the Santa Cruz County Office of Education to explore the option of launching, I'm going to say, mental health career pathway, career technical education course. That's not the official name of the class or the course yet. We're actually going to be workshopping that to come up with a more appropriate title that would engage students and help them identify and understand what these careers are. So a survey is going to go out at the beginning of next year to gauge students' interest, and then we're hoping that a pilot class could get started in the fall of 2023. And a career technical education course is a course that students who enroll generally get, they can either get like college credit, or it's articulated to a college course. So we're working with Cabrillo College in their human services department to have this CTE course match or be, I can't think of the right word right now, but articulate over to a Cabrillo College course in health services. Our community health workers work group has been working on a resource guide that's pretty much almost done, and we'll have it posted to our website, and we'll send out information to partners in the new year to share that resource. It has a lot of information about community health workers in our region, job classifications, different training programs and webinars available. So there's a lot of wealth of information in that guide. And then we also have been working on a career pathway flyer that we're going to have English and Spanish versions that helps let the community know, like, what does a community health worker do? And if it's a career you might be interested in, where can you do a training program? And what's kind of like the skill sets and the wages you could expect to earn. So those will be coming out at the beginning of this year, or sorry, beginning of this new year coming. And then our medical assistant work group is currently working on putting together an externship best practices guide that would be helpful for employers to utilize, and also some guidelines for working with the community colleges and the training programs. And so that will be coming out also in the new year. And last but not least, our nurse group, we just had a great conversation this week, and one of the outcomes is we're going to work on putting together a financial resource guide for new nurses or new graduates from nursing programs that helps them understand financial options for them regarding like loan reimbursement and other things. We'll be compiling that information. You can go to the next slide, please. Just a reminder, our next quarterly meeting is March 22nd. Again, it will be virtual from 11 to 12:30. And we have the Zoom registration. You're all here, so that means you probably found the Zoom registration and were able to log in. But we'll be sure to send that out a couple more times to folks, and feel free to invite people to join us. If you're thinking of someone who you're like, they really should have been here today for this meeting, please feel free to forward the Zoom registration link to them and encourage them to join us. And you can go to the next slide. So we just want to thank you all for your participation today. These recordings of the meetings will be on our website. So the website is listed here below, hipscc.org/workforce. And we want to thank you all and hope you all have happy holidays. Whether you look happy like the people on the left, or you feel like the Grinch on the right, just wishing you the best, and thanks for your time today. So with that, we'll go ahead and end the recording and end the meeting. Thank you, everybody.
Thanks, everyone.